Teach fertility awareness to your clients and master the skill of advanced chart interpretation. Learn to support your clients through their cycle irregularities and hormone imbalances with confidence. Our Fertility Awareness Mastery Mentorship is now accepting applications for our next class in January 2026. Head over to fertilityfriday.com/famlive to apply today. That's fertilityfriday.com/FAMMLIVE. This is the Fertility Friday podcast, episode number 590. We're about to dive into an interview that is going to completely change the way that you think about your mouth and your oral health and the potential link between oral health and fertility. For the first time on the podcast, we are exploring this topic of oral health and fertility. I am sharing my interview with Dr. Katie Lee, a functional dentist and author, and we go into some really interesting territory. Dr. Lee shares her incredible, compelling story of what drew her into dentistry in the first place. And she also talks about some very practical strategies that she employs in her dental clinic, namely regularly testing the mouth for various strains of bacteria, some strains that are actually known to have negative impacts on male and female infertility. And so I feel like with this interview, we're getting a totally different perspective of our mouth as the window into our microbiome, because it's all connected. And so if we have certain bacterial infections in the mouth, they actually are able to then go through our bloodstream and cause problems in other areas. So you may be brushing a little bit more intently and flossing more frequently after today's episode. So before we jump in, let me tell you a little bit more about Dr. Katie Lee. She is a dentist, author, and founder of the Collective Health Society, an integrated dental and medical center in Aurora, Colorado, focused on oral systematic health. She also leads the Collective Education Society, training clinicians in this emerging field. A former partner in over 80 dental practices, Dr. Lee is the author of Saved by the Mouth and serves as a clinical advisor to several dental technology companies. Her passion for dentistry began after a traumatic ATV accident as a teenager, which she shares more about in today's interview, which shaped her understanding of how oral health impacts the entire body. So without further ado, let's go ahead and jump into today's episode with Dr. Katie Lee. And I'm really excited to be here today with Dr. Katie Lee. Welcome to the show.
Thank you for having me. I'm really excited to chat with you.
Yeah, me too. I was saying to you before we hit record that we've never talked about oral health and fertility on the show. So I'm really excited to delve into the connection. But before we do, I would love for you to share a little bit about your background and what prompted you into the field of oral health. But furthermore, how did you sort out this connection between oral health and fertility?
Yeah, so it's kind of a long story. I'll try and shorten it as much as I can. I really started getting informed about oral health affecting systemic health from an accident that I had when I was 14. I was on a four-wheeler with no helmet and ran into a telephone pole head first, going 35 miles an hour. So it's a miracle that I survived, but I broke every bone in my face from my eyebrows down and lost a bunch of teeth and was in a coma for about 5 days. And they wired my jaw shut that night in the hospital, just trying to stabilize everything. And of course, losing teeth, breaking teeth, everything else, they just wired them shut. They didn't fix them. And over the next 8 weeks, I survived off of ice cream, boxed mashed potatoes, not even the real stuff, boxed mashed potatoes, Jell-O pudding. And I lost a ton of weight, had a ton of oral infection, obviously, because my teeth were rotting. And so my liver enzymes started spiking and my kidneys started shutting down and I became emaciated and severely malnourished. And so I learned at a very young age just how important your oral health is to systemic health. And when they took off my wires, I was really excited to get to eat my first meal and they took my wires off and I couldn't open my mouth at all. My jaw completely fused shut. So it took 4 years and 9 reconstructive surgeries where I was completely locked, couldn't open to fit a toothbrush in. And I admit I was missing a couple of front teeth. So I had to wear like little retainers with teeth on them, which was mortifying, in high school, because half the time I go to school and forget to put my teeth in, which was really embarrassing. And so there's a big emotional component that went along with that, a big mental health component that went along with it. And back then in the 90s, we weren't really talking about this stuff, right? It was just toughen up, like toughen up, buttercup. And so it really impacted my life in a profound way. And when I got my teeth fixed, finally, 4 years later, senior year of high school, I just remember the immediate impact it had on me having my smile back and being able to chew food and eat in a social environment with other girls. And so I said, I got to go into dentistry. I got to help other people because this is really important. And so that got me into dentistry. But then I started paying attention and noticing that most of my patients that had oral disease also had a lot of systemic conditions. And I kept seeing these correlations with heart disease, with diabetes, and I would try and work with their healthcare providers, and their healthcare providers were like, you don't know what you're talking about. You're a dentist, stay in your lane. So that really got me going down this path of let's learn more. Let's try and see if there is a connection. And so I read some great books, started educating myself, and I started integrating salivary testing into my practice. And one of the very first patients I had was a woman, but she came in with her husband. They were in their 20s, no health issues. They were trying to get pregnant and were having all these difficulties. And so they went to their OBGYN and they said, well, nothing is wrong with you, but maybe you should go see your dentist, which to this day, that is the only time I've ever been referred a patient by an OBGYN thinking that their oral health could be impacting their fertility. And I've been working really hard to change that. And it really hasn't changed that much. So I did the saliva test and they didn't know I was doing saliva tests. They just, called up any random dentist. And it turns out she had 2 bacteria in particular that are directly implicated in infertility. I also tested her husband because obviously it takes 2 to make a baby. So we're swapping spit. And he had it too. And I treated both of them and they were pregnant within 3 months. Nothing else changed with them. And so that got me thinking there's more to this. And then I had my own fertility journey where I was a patient of traditional medicine for 6 years and just saw how myopic the treatment really is for women, right? We don't even look at men except for we take 1 sperm sample and then that's really it. And then we only look at their reproductive system and we don't take into account other things that could be contributing to it. So really just kind of made this my mission to do oral systemic health in general, but specific focus on fertility because I think women deserve better and more.
Oh my goodness. There was so much in what you said. I was welling up a little bit when you shared your story because that is just, I can't imagine. You've probably shared it many times, at this point, but that is just unimaginable. I don't know if we're around the same age range, but I was, born in 82.
Yeah, 84. Okay.
Same. So we're in the same age range because and when you said you were riding with that helmet, I'm like, man, she's got to be an 80s baby.
Yeah.
Because that was the 80s. The reason that we have helmets today is because of the 80s. Mm-hmm. And I just remember when they started really pushing helmets but there was this image that they just kept putting on all the billboards to try to get everybody to wear helmets. And it was of a child who had fallen off his bike. And obviously he had to get, he broke his head open and he had to get and so when you were describing your story, I was like, oh my gosh, that was you. You were one of the people who had to go through this horrible, horrible thing and then that changed everything for us now. And now we put helmets on our kids to walk from one side of the bed to the other.
I know, right? In fact, now, or that day when I got hurt, it was July 5th, 1998. There were 2 other 4-wheeler accidents because I grew up in the country. So there were 2 4-wheeler accidents. One, someone got ran over by a 4-wheeler and broke tons of bones. And then the other one broke their neck and died. It had to be airlifted. And so there were 3 4-wheeler accidents that night, no one wearing helmets. So yeah, it was pretty awful what I had to go through. And it was all head and facial trauma. I broke my wrist. I had surgery on my wrist to repair that, but everything else was fine. It's a miracle that I'm alive. It's a miracle that I am not in a wheelchair. It's a miracle that I still have some of my brain left,
Well, and it was such a profound experience for you and how long it took you to recover. And so it was really inspiring just to hear you talk about, I take a lot of things for granted, how you try not to, but when you said that, when I finally got my teeth fixed and I was able to just enjoy a meal and chew food and smile, and I'm thinking I have never thought about that it's never occurred to me. So that just is an incredible reason that you went into dentistry and just had to comment on that because that was really, wow.
Yeah, food is so communal, right? And high school girls are mean.
Oh yeah.
Yeah, mean. So I would eat in the bathroom. Sometimes I would go
Oh.
and eat in the bathroom. Sometimes I would eat, a lot of times I'd eat in the principal's office because the secretaries were always really nice to me. But there was no way I could take my teeth out of the lunch table. Like, are you kidding me? Yeah, it's pretty hard going in your formative years, in your developmental years, going through high school, having that kind of trauma. But it led me down a great path. So I am thankful for it at the end of the day.
Mm-hmm. And then when you were talking about the early stages of what they were feeding you, and obviously that just made a whole lot worse with your teeth, right? There's a lot of interesting, so I've been a follower of like the Weston A. Price Foundation, and they have a lot of interesting things to say about the connection between oral health, dental health, and overall diet and things like that, which is just so interesting. So at the end of the day, it really feels like you were called to do this work.
Yeah. I'm so impressed that you know who Weston A. Price is. That you're just like went to the top of my hero list there. I love that. Yeah, it's super important for airway and how we develop and how our skeletons develop. And yeah, being back in the 80s and 90s, like we were raised on like Lucky Charms, right? So and Wonder Bread with margarine, and then we'd put sugar on it. So we definitely were not eating the way that we were supposed to. And then it just exacerbated all my issues.
It's amazing that we survived the 80s. I mean, I feel like the younger generation, no offense, right? But it feels like the younger generation, like, I don't know, you guys, it's a different experience. That's all I gotta say.
Yeah, for sure.
Okay. Well, so let's get into the connection because again, I'm still unpacking your story from the beginning, but when you shared about, I mean, that's even interesting that the OB suggested, like, do you know why they said to go to the dentist? Like, was there, did they have rotten teeth or something? Like, was there an avert thing or?
When looking at them, looking in their mouth, you could tell it was apparent that they had gum infection for sure. Okay. And that's where we see a lot of the issues going on between oral health and fertility is airway health and oral microbiome. And it was apparent just from looking in their mouth that they had gum infection. I don't think they had immigrated to the country, and I don't think they'd really ever gone to a dentist before. So, but that doesn't mean that they have specific type of bacteria that impact fertility because there's over 754 different types of species in the mouth. So it really just depends on if you have a couple really specific strains that impact fertility. And they, like I said, they had no idea who I was. They had no idea that I was doing salivary testing. It just happened to be fate that they walked into my office and I had just started doing the test. So.
Well, so talk to us a little bit more about that, because I mean, that's really fascinating and interesting that you have adopted that as kind of one of the standard things that you do. So maybe share with us a little bit about what you've uncovered over the years just by doing salivary testing as part of your practice.
Yeah, I would say the biggest thing that it's shown me, two things. One is that a lot of people have issues and most of the time they don't have symptoms. So a lot of people say, oh, I don't go to the dentist because nothing hurts or nothing's bleeding. Or I go to the dentist all the time and they tell me everything is great. And I say, well, if they don't do a test, how do they know, right? It's just like if you go to your PCP for a physical, if they don't take your blood pressure, if they don't take blood work, they have no idea if your blood sugar is high or if you're high blood, if you have high blood pressure or high cholesterol, you can't tell just by looking at somebody. And in dentistry, historically, we've never really had tests or used tests to show us what's going on beneath the surface. It's always just been even our judgment of what we see. It's like you go to one dentist, they say one thing, you go to another dentist, they could say something completely different. I hear those stories all the time of one dentist said I had 12 cavities and the other said I had none, right? Well, that's because there aren't, and most people don't use tests. So without tests, you don't actually know. And then you're relying on the person's judgment and their experience to make a diagnosis. So we're guessing at that point. And so bringing in salivary testing is really important. So a couple of things. One is most people have an issue and they don't know it. And the other thing is it's really good at educating patients as to what is there and why treatment is needed. Because again, I think there's this distrust between the population and dentists because the opinions are so all over the place that people naturally are like, how do I trust you? How do I know that what you're saying is true? And so this kind of, you can't ignore results, right? So that's what I found really profound with saliva testing.
Mm-hmm. Yeah, no, that's really interesting. And one of the things that I talk about with our practitioners is, so my background, of course, is fertility awareness cycle charting. And so one of the main things that we do in our practice these days is to teach women's health practitioners to actually use the menstrual cycle as a vital sign. And so one of the things that's interesting about that approach is that you can look at the cycle and see a lot of implications. You can see a lot of implications about hormones and things like that. But often it's the testing. So the cycle can then inform the test that you are doing instead of just doing a barrage. You can be a little bit more precise. But then it's the testing and the results that prompt the client to get into action because now they have that data to say, okay, there's really a problem. You could talk about something all day, but then when they get the test that nutrient is low or that the sperm count is off, all of a sudden now we've got some motivation to take some action.
Yeah, definitely. And I find that in dentistry all the time. Unless you can test, it's kind of hard to motivate. People are motivated by like pain, right? So if they have pain, they're motivated. But the problem with microbiome issues is oftentimes there's no pain. Sometimes people have bleeding gums. Sometimes they'll have bad breath, but oftentimes there are no symptoms. And so it's really hard to motivate someone who seemingly thinks they're fine that has no symptoms that they need to act. And so, yes, you're totally right. The test results get people to move.
Popping into today's episode to let you know about our newest resource for women's health professionals, the Practitioner's Guide to Optimizing Egg Quality. This comprehensive guide breaks down the 5 key steps to improving egg quality, along with the top 5 evidence-based supplements to support egg development, mitochondrial health, and implantation potential. Head over to fertilityfriday.com/egg quality to grab your complimentary copy today. That's fertilityfriday.com/egg quality. Now let's go ahead and jump back into today's episode.
Well, so question for you. You gave the example of this client of yours, and they were trying to conceive, and they both had this bacteria. So talk to us about that connection. How could a bacteria in your mouth have any effect on your ability to have a baby?
Yeah. So the important thing to note is that the mouth is really the entry point to the body, the largest entry point to the body. And it's the second largest microbiome that we have, second to the gut. And so there's this huge amount of bacteria that's there, and less than 1% of our total oral microbiome are bad pathogens. But what happens because of diet, stress, environment, the people around us, what have you, the microbiome can shift and become out of balance, just like in your gut. And what ends up happening is when the body senses that something is awry in the mouth, it releases the body's white blood cells to go attack whatever shouldn't be there. And the white blood cells are really large cells. So they can't fit through all the tissues to get to the source of infection. So the white blood cells release an enzyme called MMP8. This enzyme is a collagenase enzyme, which just means that it's a scissor and it goes through and it cuts through all the tissues to allow the cells to get to the source of infection. It breaks down any collagen in the body. So if someone has leaky gut, they also have leaky gums. If they are suffering from arthritis, they're going to have gum issues. And so what happens is the gum tissue starts to break down. Our gums are supposed to be like our skin in the sense that it's a physical barrier. So it keeps the environment out and keeps what's in our body in. The gums are supposed to be the same thing, except the gums are actually penetrated by our teeth. So they're already kind of weakened because our teeth are coming up. But the gums then form these tight junctions around the teeth to kind of wall everything off. But that collagenase enzyme will go in and break down that gum tissue that's right there. So then what happens is the gums are no longer sealed to the teeth. Now the bad bacteria that are in the mouth love to burrow into that gum tissue, and the gum tissue is where the blood supply is. That's why gums bleed. So once the bacteria hit the bloodstream, they can circulate and go anywhere in the body. And one of the main places that oral bacteria love to go are the female and male reproductive systems. And there's a couple of bacteria in particular that really, really do a lot of harm.
Okay, that is mind-blowing. So let me just try to backtrack to make sure I understood what you just said. So, because I'm in my mind, one of the questions that I have for you is like, is it the chicken or the egg? Like, is it that I have this issue with my gut and then it's manifesting in my mouth? Or is it that I have, because what you described is like, is that a product of bad oral hygiene that the gums have gotten to that stage and then it's allowing the penetration of the bacteria to where it hasn't been? Or is that a product of the bad gut health? Maybe explain it a little bit more so that I can understand, like, where is it coming from?
Love to. I just got done talking with a patient about this that is having gut issues. So the gut microbiome, critically important, right? But we got to take a step back and think, how did the microbiome get to the gut? We're swallowing over 1 trillion bacteria a day. Most of that bacteria are going to get eradicated in the stomach and small intestine. The one that we're really concerned with are the ones that get to the bloodstream and get to the gut that way, because they can really bypass our protective mechanism organs like small intestine and stomach. So we're not really concerned about what we swallow, although we are more concerned about the bad pathogens in the bloodstream. There's about a 45 to 50% overlap between the oral microbiome and the gut microbiome. I have definitely seen it go both ways, where someone has gut issues that then first show in the mouth. In fact, before we really knew a whole lot about this oral systemic health connection, which is crazy to think about it. Your mouth is the opening to your digestive system. So it's crazy that we never really thought of it this way. Most of gut issues show up first in the mouth. So we'll see people with Crohn's and IBS actually have certain sores and present certain ways in the office, in the dental office, and say, oh, I think you have IBS or Crohn's, go see your doctor. So that's been going on for decades. We always say the mouth is really a mirror to the body. So sometimes I'll see it that they have something in their gut that then works its way back up to the mouth. But I also see it the other way, where sometimes it starts at the mouth and it goes to the gut. Unfortunately, I don't really get to patients early enough to be able to detect where it's coming from first. Although I did have a family member that was like the epitome of health. And I write about this in my book. I mean, she gets up every day at 5 to work out. She didn't even have plastic in her house, like all glass, everything. Makes all of her own food, nothing processed, right? Doesn't drink alcohol. Like she's just the epitome of health and never had a cavity. And so I would never really save a whole lot of time for her at my office because I knew her cleanings were going to be super quick. And then one day she came in and I started doing her cleaning and I was like, oh my gosh, what is going on with you? Something is not okay. Like she was bleeding like a stuck pig, tons of inflammation. And I said, have you been sick lately? Do you have any gut issues? And she said, I'm so glad you brought this up because I have not been feeling well for months. And I've gone to GI doctors, my primary care, they've done a colonoscopy, they've done an upper GI, they've ran blood work. They say everything is fine. I ran my test and I'm like, everything is not fine. So we treated her and then I sent her to, or she actually found a functional medicine doctor and she ended up having SIBO. So in that case, specific case, I think she had SIBO in the gut first and it translated to the mouth because just knowing her personally, her mouth was always healthy. So it's hard to tell if it's chicken or egg, but I do know you have to treat both. You can't have a healthy gut without a healthy mouth.
Oh, that's so fascinating. And so what you said about if there's the leaky gut issue, if you have this enzyme that's kind of penetrating through and essentially weakening that barrier that you would naturally have in your mouth, you could have these harmful bacteria essentially getting into the bloodstream from the mouth and then targeting different areas of the body, and that could be contributing. Also fascinating that you can just pick up on, I didn't know that there was, that in the dentist office, they could pick up on certain gut issues just by looking at your mouth. So I feel like this is very, very interesting information. So one of the questions I have then is, what do we do about this? I mean, in the case of your family friend, like she was flossing, right? It sounds like she was on top of it.
Very healthy.
So this was a different thing. This was not like, is inflammation of the gums called gingivitis? Is that what it's called?
So gingivitis just means that the gums are inflamed. Periodont, and that is reversible, meaning we can treat it and the gums will shrink back. Periodontitis is where you have inflammation of the gums, but you've also lost bone. So now the bone is dying around the teeth. That we say is irreversible because we can't get the gum tissue or the bone to grow back. Either way, the bacteria are the same and the process is the same. It's just the time frame in which you caught it. So if you caught it early enough, the patient will just have gingivitis and you can reverse that. But the bacteria are still getting into the bloodstream and damaging the body. So it doesn't matter if the bone is there. I mean, it does matter for us, but I mean, the disease process and the systemic implications of that are the same.
Well, and so, I mean, obviously there's different things going on. So if you're brushing and flossing and doing the things you're supposed to do, so tell us what the impact is of that versus someone who is brushing and flossing but has like a deeper issue that is then manifesting. Because it sounds like you could be doing the brushing and flossing, but if you have an issue, it could still be presenting. And
absolutely
thoroughly confused because it's like,
absolutely. Yeah. And that's actually the patients I see at my new office is I'm a good patient. I brush, I floss, I'm doing all the things that I'm supposed to be doing. I go to my dentist every 6 months and like, I still have all these issues. And so a lot of other things can impact it. So diet is a big one. High sugar or carbohydrate diets will affect it. Food sensitivities will affect it. Airway health is so critical to our overall health. So oftentimes our patients have airway issues and don't know it. Environment, maybe they're low on some nutrients and vitamins, that can do it. And stress, sleep and stress are big ones. Another big one is alcohol. Unfortunately, everyone, me included, loved my glass of wine a few nights a week, but It's not good for our oral microbiome. It wipes out all the good bacteria and leaves only the bad. So that destroys our microbiome.
Well, and you've mentioned airway issues a couple of times. Could you briefly just give us a rundown on what that means?
Sure. So airway, what I'm talking about is a couple of things. One is nasal breathing. People absolutely need to breathe through the nose. Our nose has all these turbinates with trillions upon trillions of cilia, which are little hairs that filter the air. So we have our own air purifier on the front of our face. We're born nasal breathers, but we develop into mouth breathers. And it's chicken or the egg, but once you breathe through your mouth, you're inhaling all of the dirty air. And that's when we start to get allergies. It's when we start to get sinus polyps. It's when our sinuses, instead of being flat at the bottom of our face, start to peak. And then we don't have enough volume. And so it just perpetuates this mouth breathing. When you breathe through your mouth, you get less oxygen into the body. You get more inflammatory pollutants. So it'll cause a lot of lung issues, a lot of systemic inflammation, dries out the mouth, causes our saliva in our mouth to become acidic. We reduce our nitric oxide, which is a vasodilator that we need. So there's all kinds of issues with breathing through the mouth. But then that can go even further into someone developing airway disordered breathing or sleep apnea. So as we age, we lose collagen, we lose our muscle tonicity, and as women, we lose our bone mass. And so we have less structure for our muscles and skin to attach to. So when we go to sleep at night, everything collapses and our airway collapse. You combine that with Winston Price, and what he is saying is that our jaws have actually shrunk over time, which they have, because of our modern day diets. And so there's not enough room for our tongue. Our sinuses aren't developing properly. We're not breathing correctly. And so people will develop sleep apnea. And about 80% of people who have sleep apnea are undiagnosed. And that is critical for fertility, critical for oral health, critical for heart health and brain health. So we know that patients who are having fertility issues, I'm always going to run a sleep apnea test on them, because if they're not breathing, and when you get pregnant, you start snoring anyway, right? You're gaining weight, you're getting big, you can't sleep comfortably. And what ends up happening, if you're not oxygenating your blood, you need oxygenated blood getting to that fetal artery to help that baby develop. So we see a lot of preterm births and low birth weight babies in people who have airway issues.
Oh my goodness. I just didn't realize there was so many ways that our oral health was connected to, but it makes perfect sense. It's one of those things where as soon as you talk about it, it's like, well, yeah, that actually makes a lot of sense, but just haven't necessarily thought about it. I do have a question before I go into some of the fertility specific questions, which is about root canals. So, because I think that, I've read a lot of things that would suggest that they're problematic so I feel like there's probably two different camps, and I'm curious what your thoughts are on it. And I haven't had one, but my understanding, so correct me, because I don't know what I'm talking about, because this is not my field.
Yeah.
But my understanding of a root canal is that, you're drilling through the tooth when you have an issue with your tooth, and they leave it in there, but they drill it. So they essentially kill the tooth and then it's dead. And there's people who would say that having a root canal tooth in there can cause a lot of problems for people, because it's essentially a dead tooth that is. So but I don't know if it's controversial or not. But dentists are still doing it.
Yeah, it's very controversial. Yeah. It's a hard question to answer. And what I always try and do with my patients is just give them as much information as possible and let them decide. So our teeth are organs, which is crazy to think about. They have a blood supply and they have a nervous system, and they're connected to the body's circulatory system, and they're connected to the body's nervous system. That's why teeth hurt, right? And so when they become infected by a cavity, and you get pain and the nerve and the blood supply gets infected, that's not good for our bodies either. We don't want our bodies fighting any sort of infection anywhere. And so then the question becomes, okay, well, what do we do about it? Do we take the tooth out and replace it with a foreign body, such as an implant? Because we don't know necessarily how that person's going to respond to an implant. Most people, 95 out of 100, respond just fine to an implant, but it is a foreign body that you are implanting, and you can do metal or you can do zirconia. Some people say ceramic implants are better. And the research is coming on that. In the past, they have not been better. In fact, they fail after 5 years, which the immune process that happens for a failing implant is very significant on what that does to the body. So they are getting better, but they're not perfect, which, by the way, I have 3 implants, so they do work. But the problem with implants is implants aren't teeth. And so they're not connected to the circulatory system, and they're not connected to the nervous system. So they're much less able to fight off bad bacteria than our teeth are. Because our teeth are organs and they have that blood supply and that nervous system, if they get attacked by cavity causing bacteria or periodontal causing bacteria, they can kind of fight it off because of all the blood supply around it. Implants don't have that. They're inert. They're stuck in the bone. So implants get disease easier. They have more damage around them faster. So the amount of bacteria that it takes to cause damage around the tooth is a lot higher than what we see with implants. And even if we do go treat a diseased implant, they respond less to treatment. So you're not really solving a lot by taking a tooth out and getting an implant. Now, on the flip side, do you get a root canal? The problem with root canals is because they can be done biologically and pretty healthy. But the problem is that now we've killed off the tooth and we've left a dead tooth there. Now the tooth doesn't have an immune system either. So it's more prone to decay. It's more prone to gum disease. But the bigger issue is because that nerve is gone, if the root canal is not done properly and it's not monitored, they can develop an abscess around the root of that tooth. And that abscess can go unchecked for years because the patient has no symptoms. I actually had a situation like that when I was undergoing fertility treatment or getting ready to start. So I want to make sure I had no infection. So I took an x-ray and it turns out I had an abscess on a root and I had no idea. So if you leave that infection there unchecked for a long time and no one finds it, that does significant damage to the body. So I try and let patients make their own decision on that. If they choose to do a root canal, we want to do it safely. We want to do it with a specialist that has microscopes and advanced imaging to make sure we get everything cleaned out. And then we monitor it twice a year to make sure it's not developing new infection. If they want to take the tooth out and do an implant, that's great too, as long as they know that we have to take even better care of an implant than we would the teeth. But I would personally like to try and avoid the cavities going to the nerve in the first place so we don't have to make that choice.
Mm-hmm. Well, thank you for taking us through that. It's all very confusing because there's a lot of different information and there's a lot of people that are very passionate about both camps and they share a lot of information. So I appreciate your balanced perspective on that. Yeah. But at the end of the day, it doesn't sound like there's a clear answer. And then one last question on
prevention, right?
Obviously, yes.
Yeah, prevention.
Yes.
And the other thing you don't want to do is take the tooth out and leave it. If you take out your first molar, your chewing capacity reduces by 45%. You take out your second molar, it reduces by 55%. That creates way more issues for TMJ, airway, digestion, systemic inflammation. So if you're going to take the tooth, a lot of people say, just take my tooth out and leave it. Like that's probably by far the worst thing you could do. So
that was going to be my question, actually. So
yeah. A lot of patients will just say, well, I don't want either option. So just take it out. I'm like, I would really advise against that for sure.
It's so fascinating. Now everyone needs to go and make an appointment with their dentist. So I wanted to ask you about, because I know one of the things that we talked about before we started recording was the interesting connection between the oral microbiome and certain conditions, like whether it's endometriosis or PCOS or even bacterial vaginosis. So I'd love to dig into that a little bit as well.
Yeah. So the same bacteria that are causing infertility issues are the ones that are going to be contributing to these issues. So there was a study that was done in 2023, I believe. There was 155 women that they looked at to see if the oral bacteria, Fusobacterium nucleatum, was contributing and or causing endometriosis. And what they found is that in 64% of those women, they had oral FN present in their endometriosis lesions, versus they sampled women that had healthy endometriums and only 7% of them had oral FN. So pretty significant finding showing that FN does at least contribute to or find a way into endometriosis lesions. So, and that was my experience I had in my practice. I had a patient come in, young woman, had no systemic symptoms that she knew about. And we did her exam and my hygienist was like, Doc, something's wrong with this patient. Like she is bleeding. I don't see any buildup on her teeth because typically the more buildup someone has, the more they'll bleed. She looked squeaky clean. And she said that she had always bled since her teenage years. So we tested her. Her FN was off the charts. Her MMP was off the charts. We treated her. She came back 3 months later and she was better, but it wasn't great. And so I sent her to her PCP and to an endocrinologist, and they started digging and they found she had systemic endometriosis. She had lesions in her lungs, had no idea. And so she was treated successfully and was in remission. So anyone that has any kind of female issues, even if they're not trying to get pregnant, should definitely come and get a saliva test just to make sure that they're okay. PCOS, very similar. FN and PG contribute to PCOS. We know that PCOS has implications with insulin sensitivity. When we have insulin sensitivity, we'll have a lot of systemic inflammation, and the oral bacteria can cause that systemic inflammation and can contribute to insulin sensitivity issues. And then what was the other one? You said PCOS?
Bacterial vaginosis.
Yes. So there's a microbiome down there too, right? So we got to make sure that everything is in balance. So there's a couple supplements or lozenges rather, that I recommend some patients to have when they have oral microbiome issues. And what we know is that they insert one of those lozenges actually vaginally. Oftentimes it clears up their bacterial vaginosis. So it's all microbiome stuff that we got to balance.
Did you know that you can listen to Real Food for Fertility for free with your 30-day trial of Audible? Head over to fertilityfriday.com/realfood to listen now. That's fertilityfriday.com/realfood.
So then what do you recommend? So I suppose this is like the natural question now that we're scared off about all this bacteria.
I know. I don't like to scare people because there's so many solutions. That's the thing.
Yes. I mean, but at the end of the day, it's good to know because I mean, I, for one, don't necessarily spend a lot of time thinking about my oral health. I mean, I definitely do my best to be on top of it. I'd be like one of those people that you've mentioned, like I floss every day. I actually do. And I make my kids floss every day, although I think they skip a couple days here and there. And so, you feel like you're doing what you need to be doing, but what are your general recommendations for us to maintain good oral health?
Yes. So first thing is I would get a saliva test because you got to know what's there. Oftentimes people have issues and they have no idea. So figure out what's there because half of the bacteria don't respond to regular cleaning. So a lot of people say my gums bleed, but they've always bled. Well, that's probably because they have certain bacteria that don't respond to cleaning. So they're getting the wrong treatment. So get tested first, get that fixed. And then after that, things that you can do at home. I love patients to be on an oral probiotic. Oral probiotics are different than gut probiotics. So the bacteria we need the oral probiotic to dissolve in the mouth so the bacteria stay in the mouth. If you're swallowing a probiotic, that's helping your gut, but doing nothing for your mouth. So you need to be on an oral probiotic. You also need to be on these 2 lozenges that I love from Daily Dental Cares. One is Fossident, which is great for preventing cavities. And the other one is Protectin, which is great for preventing gum disease. There's also a water additive of that you can drink to help your gut. And then you can insert that one vaginally for bacterial vaginosis. I tell everyone that they must brush twice a day with an electric toothbrush and they must floss. So floss twice a day. In between our teeth, we have our gum tissue. Our gum tissue is where our blood supply is. And in between the teeth is the only place that the toothbrush does not hit. So I tell people if you're only brushing, you're hitting 3 out of the 5 surfaces and you're missing the 2 most important ones that are directly next to your bloodstream. So must floss every time you brush. So if you brush twice, floss twice. And then tongue scraping is really important. Our tongue has its own microbiome. Granted, it's different from everywhere else, but that's really critically important in preventing like bad breath and things like that. And then get an airway health test to make sure that your airway is good. Because like I said, 80% of people are undiagnosed for airway. Then when we talk about supplements and diet, so the oral microbiome loves plant-based foods. In terms of the thing that can really support your oral microbiome is prebiotics. So if you don't want to be on a plant-based diet, just make sure you're getting tons of prebiotics, so lots of fiber. And then our teeth actually love more animal-based stuff. So if you want super strong teeth, you need to make sure you're getting vitamin A is critically important. Vitamin K2 and D3 is really important. And magnesium. Everyone is so depleted on magnesium. They should be taking a magnesium supplement. So those are kind of my tools that I arm patients with when they come to see me.
Mm-hmm. As you were mentioning all of those strategies. So thank you for that. Now I have to contemplate flossing twice a day. I only floss once a day.
Yeah. Most people do. I did for up until like 8 years ago when I really got down this path. But if you think about it, your gums, right? The pointy papillas, those are in between your teeth. That's the only place that your toothbrush doesn't hit. And that's where your blood supply is. So you have to clean that.
Mm-hmm. Well, so there's this really interesting book that I often share with our practitioners called Cure Tooth Decay. I think it's by Peter Nagel. Is that?
Oh, I haven't read it, but I'm going to.
it's along the lines of the Weston A. Price philosophy. And the concept basically is when someone has a cavity in the early stages to potentially reverse it through diet. So,
Totally.
Liver,
Totally.
so the vitamin A, cod liver oil, and then reducing the consumption of the processed foods and all of that good stuff. So I feel like I'm not saying that, I think it's a really important resource. And I suppose one of the ways that I have seen dental health reflect overall health would be, so from my perspective, again, not my field, if I have an intake with a client and I notice that they've had like 6 root canals, that's a pretty good sign that they are potentially undernourished. Certainly haven't been eating in the way that the author of Cured Tooth Decay would indicate, right? The high nutrient dense foods that actually actively kind of work against the development of cavities. I'm not sure if you have a comment on that, but that came to mind because you took it to another level with the connection between oral health and fertility, but I feel like I've seen it in that way, just that, or people who have like tons and tons and tons of cavities. To me, that's a sign of certainly just like what you explained in your own personal experience of being fed. What did you say? Ice cream and Jell-O?
Yeah.
And it led you to have just not like it.
The rest of my life. Like I'm still dealing.
Cavities.
Yeah, I'm still dealing with it. First off, I want to just commend you for thinking, even connecting those two and thinking about it, because most people don't pay attention to it. Like I said, I'm so impressed that you know who Weston A. Price is. I think that's miraculous. And you're absolutely right. If you look in someone's mouth and they have tons of root canals, tons of fillings, tons of cavities, you know something is wrong, right? Like that's not healthy. And oftentimes they are undernourished. Oftentimes they are eating a ton of processed foods and or sugars. And we know that processed foods and sugars spike our immune system, right? It causes a ton of inflammation. And we know inflammation is not good when you're trying to have a baby. And so there's a lot of work that can be done with diet alone, which is why in my office, I have a certified nutrition specialist. So everyone that sees me sees her, because I can fix your teeth and fix your microbiome. But if you're not eating sustainably, all my work 3 months, we're just going to be doing this again. So nutrition is critically important, and you need both, right? You need plant-based stuff for microbiome and you need animal stuff for teeth. The other important thing that this is top of mind because I just saw a patient with this, is if someone has a lot of root canals, it can also mean, and if they have a lot of abscesses on their root canals, that tells me that their immune system is shot, because they should be able to ward off infection. And so if they have a root canal and the root canals just keep getting infected, which I do see this in a lot of patients, they just keep getting recurrent infections around root canals, I know they have no immune system, which tells me that cortisol is probably through the roof, adrenals are fatigued. It also probably tells me they probably have infection and inflammation going on other places. And so we just now have to go on a hunt and try and find where all this stuff is coming from, because the body should be able to heal itself to some degree. If they have fillings on all their teeth and recurrent abscesses, I know they have no immune system.
Mm-hmm. Well, so one other comment that I want to make, and then I have another question, of course, is that, so one of the things that's really interesting about Weston A. Price's work, so for anyone who isn't familiar, because I'm sure there's people listening who haven't necessarily heard of his work, but he was a dentist, and, in the 30s and 40s, like if you get his book, I'm trying to remember the name of his book. Is it Nutrition and Physical Degeneration? I think it's called.
Something like that. It's like a manual, it looks like.
Yeah. But it was like, he wrote this book before like the social conventions that we have now. So he traveled the world. And as a dentist, it seems like he had this one question, which is like, how could people be living in these industrialized societies with access to all of this money and all of these, all of the things, but have horrible teeth, like rotting out? Because this was before we had proper dentistry. So when people had bad teeth, they would just walk around with bad teeth. Like nowadays, you wouldn't even be able to tell because you can fix it, right?
Yep.
But he would go into these just places, whether it was the Swiss Alps or whether it was African places where they're not yet in the modernized world, people who aren't even brushing their teeth. Who have no cavities and a perfect jawline structure and stuff like that. So that's just to give a little bit of context for anyone who hasn't heard of it, why we keep bringing it up. But I think one of the things that really stood out to me many years ago when I first discovered this information was that when I was a kid, they taught you to brush your teeth. And I had the idea that it was like the sugar would be on your teeth or something and causing the cavity on your teeth. But I feel like when you talk about this concept of nutrition and what you're actually eating and how that could almost make you immune to cavities, then it kind of challenge the idea that it's just like you're just brushing the stuff off your teeth. If these people can never brush their teeth, but because of their diet, they don't get cavities.
Yeah. So a couple points there. One is cavities are caused by a couple specific strains of bacteria. So if you have these strains, Strep mutans and Strep sanguinis, I can never say this one, sanguinis, if they're out of balance, right? If they're high and your good microbes can't keep them down, then you're more prone to getting tooth decay. So I will test patients in my practice that say I always get cavities. I want to know, is this a bacterial issue? Is this a diet issue? Or is this like the mineral makeup of your teeth issue? Which very often that's not the case. A lot of people say it's genetic. I got it from my mom. That's usually not the case. It's more of a bacterial issue. So I will test for those types of bacteria. So you have to have the bacteria. Then you have to have food for them. Those bacteria love sugar and processed carbohydrates. So what happens is it's not the sugar that causes the cavities. The bacteria love that sugar. So they'll eat the sugar and then they excrete or poop out acid on your teeth. It's the acid then that's dissolving the teeth and causing cavities. The other thing is that every time we eat, the acidity level in our mouth rises. So the pH in our mouth goes down because that's the way that the body can start digestion. So we secrete salivary amylase, which is an enzyme that starts to break down carbohydrates. So the more often you eat, the more times you're pushing the pH in your mouth acidic. So the more times you are triggering this whole cavitation process to occur. This is one thing that I grew up making a horrible mistake because I always thought, to be thin and fit, eat several small meals throughout the day. So I would munch all day long on stuff, oftentimes pretzels, right? Because they're low fat, low carbohydrates. Those are like the worst things you can eat for oral health. So what you really want to do, stay away from processed carbs, stay away from sugar, make sure you don't have those two types of bacteria. But if you just stay away from sugar, stay away from processed carbs, and don't eat that often, you'll be fine. So oftentimes nutrition counseling for my patients and just say, we really need to get you not eating as often. I'd rather you eat bigger meals less often. Now, if they're diabetic or, type 1 diabetes or something, we have to do something different. And the two supplements that I was recommending before, the Fossetin and Protectin, what they do is they actually make the mouth a ketogenic environment. And when the mouth is ketogenic, the bad pathogens can't survive on a ketogenic environment because they love sugar. So they die off, and then our good pathogens flourish because they like proteins. So it's kind of like a hack, if you will, of making your mouth sugar-free is by having those supplements.
Oh, that's so interesting. And thank you for breaking down how cavities are formed. I feel like I'm in school again. I'm learning so much today.
I can tell you're such a good student. You get the information very, very quickly, and you know so much already, which is great.
Well, so one very practical question for you, because it sounds like we would all have the most amazing experience if we came into your office, but I imagine that every dentist is not necessarily as versed in this. So tell us about the state of dentistry and how do our listeners who are now concerned about their oral health, how do we find a dentist that is in line with this? Where, is it a standard thing? Can we ask for a salivary test from any dentist, or do we need to be looking for a holistic dentist? How does this work?
So, it's tough because there really isn't a whole lot of people that practice this way, unfortunately. I'm trying to change that, obviously. So a couple options that people can do. Yes, certainly look for a functional or biological dentist. You can go to the IAOMT website and search for biological functional dentists near you. However, they may just be biological or functional in that they remove amalgam fillings, right? A certain way to make sure it doesn't get in your system. Maybe they place ceramic implants, or maybe they do ceramic fillings. So the range of what a biological functional dentist is greatly varies. So it's not necessarily that they do saliva tests. oraldna.com is a great resource. It's a type of saliva test that's out there. They actually have a directory. So if you type in your zip code, they could be able to tell you what dentists in your area do a saliva test. Now, there's many other tests on the market that are just as great. I don't think that the other ones have a directory like that. So yes, try and look up a functional biological dentist, try and look up to see if they do saliva testing, but call ahead and just ask. And you'll probably have to call several people before you find someone that will do it. But it's critically important to get this kind of testing done. I do remote telehealth testing for people. So I can always, if they contact me, I can ship them a test, go over results, and then help them get a care plan with a local dentist. That way we can get them treated. And then in terms of state of dentistry, I would say the information about oral systemic health is getting out there, which is really exciting. The American Dental Association is finally acknowledging that the mouth is connected to the rest of the body. And so they actually have a meeting coming up this summer talking about oral systemic health. So more and more people are getting aware of it. I think it's, it's hard because a lot of the stuff isn't covered by insurance, right? By dental or medical in terms of the testing. Fortunately, it's inexpensive to get the test done, which is great. But I think it's going to be a long time before people can get up there and get educated.
Mm-hmm. And if somebody is struggling with fertility challenges, they're trying to conceive, or they have certain menstrual challenges, are those themselves a flag for oral health? Or would you say that there's a few specific things? Like you mentioned the bleeding thing many times today. So it seems like that would be definitely a sign. Is it just bleeding with brushing and flossing and that kind of thing where it's constantly bleeding? But are there any other just things that come to mind that we should be aware of?
Yeah. So I always tell people, if you're thinking of trying to start a family, if you're trying to start a family and you're having difficulty, or if you have endometriosis or PCOS, like you need to get a saliva test, because it's just another place to look under the hood, right? To see what's going on. Signs and symptoms would be bad breath, sensitive teeth, bleeding gums, frequent cavities. That's another big one. And then for airway health, it's going to be anyone who breathes through their mouth. If you wake up at night frequently to go to the bathroom, anyone who clenches and grinds should have an airway test. If they're suffering from acid reflux, if they're on 2 or more high blood pressure medications. And this is irrespective if they snore or not. A lot of people say, oh, I don't have apnea, I don't snore. Snoring is like, sure, it can be a sign, but I see a lot of patients who have apnea that don't snore.
All right. Well, just so much information. This has been wonderful.
I just info dumped on you guys.
Hey, that's why we're here. Well, so let us know a little bit more about your practice. So tell us again where you are physically. I know you also mentioned that you do telehealth. Work with clients. Tell us, give us your website, your socials, all the things, and then also what you have in your book, and so everything, but also if there's anything interesting on the horizon for you as well.
Yeah. So I did write a book called Saved by the Mouth. You can get it on Amazon or from my website. I was really shocked I didn't think anyone would read it. It's all about oral systemic health, but I tried to write it in a fun, cheeky way. So I talk about patients in my practice and them having a certain systemic disease and what we did to treat it from an oral perspective and how their symptoms resolve. So Saved by the Mouth, it's a great, easy read for people. They can get it from Amazon or my website. My website is katieleedds.com. So DDS, dentist surgeon.com. They can also book their telehealth saliva test with me too. So I coach, consult, and do saliva testing for people all over the world, actually. So I have patients all over the place that I can treat. And what we do is we'll do the saliva test, we'll figure out what's going on, and then I'll get a holistic care plan together for the patient and work with their current dentist or help them find a new provider if we need to that can render that treatment. And then I just opened up my brand new practice a month ago. It's called the Collective Health Society. It's been a 2-year in process kind of project, a fully integrated dental and medical center. So it's me, I have a medical director, I have a certified nutrition specialist who does cellular health testing, hormone imbalances, toxins, parasites, nutrient deficiencies. She's amazing. We do myofunctional therapy, we do airway, and I have an IV clinic also here. So that opened up, and then I have a training and education center called Collective Education Society, where I'm trying to educate providers all around the country on this topic.
Well, that is amazing. I am excited to just sit back and watch you change the face of dentistry. This is going to be very enjoyable, I think, for me to watch.
Thank you. Oh, yes. And follow me on Instagram. So Katie Lee DDS on Instagram.
Awesome. Well, thank you so much for being on the show today and sharing your wisdom. I feel like you've blown a lot of minds and you've reminded us how important it is to focus on our oral health. So really excited to share this interview.
Thank you so much for having me.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page at fertilityfriday.com/590. I hope that you enjoyed today's episode as much as I did. I had so many takeaways from this episode. I think the biggest takeaway I had was the connection between oral health and fertility. Certainly very eye-opening to think about all the bacteria that could be building in your mouth. And not only that, it doesn't stay in the mouth. It can have then full access to your bloodstream and go into various different parts of the body and cause all kinds of problems. So that is certainly eye-opening. Really emphasized how important it is to pay attention to our oral health. So a great reminder for any of you who don't floss, if that's a thing, it's a great time to start. I've fortunately been flossing for decades now, but only once a day. And now I've learned that is not enough. So I'll keep you posted on if I'm able to incorporate the twice a day brushing. Full disclosure, since this episode was initially recorded, I have not started flossing twice a day, but certainly have been very consistent with my once a day flossing and twice a day minimum brushing. And there are times when I might floss an additional time if I've eaten something, but it's usually that. If I've eaten something and I can feel stuff in my teeth, then I might have to get an extra floss in there. But with that said, I mean, there's so much to think about. And one of the other points that stood out to me from today's interview was the potential link between unexplained fertility and these hidden infections that can start in the mouth and then cause these different problems. So her recommendation for if somebody has experienced unexplained infertility, even to be thinking about their oral health and potentially having their saliva tested for certain strains of bacteria. I mean, that is just not something that typically comes to mind. So a really great reminder on the complexity of our bodies and how our body is a system that is connected. And even our oral health can play a role in overall health, again, because of this potential for our mouths to harbor unfavorable bacteria and other critters. So if this episode resonated with you and you can think about somebody who would benefit from hearing it, then please do share. The share link is fertilityfriday.com/590. If you have been listening to this podcast for a while, loving it, and you haven't yet left a review on Apple Podcasts, I would invite you to leave a review. It's how people learn about the podcast. It really helps people when they've just, recently found it to see what others are saying about it. I think we all do that now whenever we are finding something new. If we're shopping for something, we're always looking at what other people are saying about it to see if it's worth our time. So really appreciate all of you who've taken the opportunity, taken the chance to review the episode and to share it, because that is one of the most powerful ways that this podcast has continued to reach new people, and people have continued to find it over the years. So with that said, I hope you have a wonderful weekend, whenever you're tuning into the show. And of course, as always, until next time, be well and happy charting. If you're loving the podcast and you're ready to apply fertility awareness strategies in your women's health practice, then I know you'll love our Fertility Awareness Mastery Mentorship. It's a 9-month immersive experience that will completely transform the way you work with clients, allowing you to not only teach fertility awareness, but to use the menstrual cycle as a vital sign and diagnostic tool in your women's health practice. Our next class starts in January 2026, so there's still time to reserve your spot. There's no other program like this offered anywhere. Transform your practice in 9 months. Head over to fertilityfriday.com/famlive to apply now. That's fertilityfriday.com/FAMMLIVE.